Hello everyone, this is Dr. Uma. Today I am going to discuss about international agencies which is related to the welfare services to the children. So under this topic we have nearly 5 to 6 agencies, especially international agencies, those who are working in the welfare of the children. The first one is the World Health Organization. In short term we say it's WHO. So World Health Organization is one of the non-political and dedicated health agency of United Nations. It was started in 7th April 1948. These agencies are not at all involving any political affair of any country, and they are focusing mainly on health of the world population. Its headquarters is situated in Geneva. Every year, 7th April, we celebrate the World Health Day to focus on specific aspects of public health with theme. So every 7th we celebrate the World Health Day with specifically mentioned theme. So this is about objectives of WHO. So main objective of WHO is attainment of highest level of health by all the people in world. It will permit the people to lead a physically, mentally, socially and economically fruitful life. Next we'll see about membership status. In the beginning, in 1948 when they opened, WHO membership was 56, but at present it is having around 194 members. Next we'll talk about structure of WHO. Basically structure of WHO is divided into three categories. Three kind of boards are available. They run the WHO works. The first one is the World Health Assembly, second is the Executive Board, and third Secretariat. We'll see one by one. The first one, World Health Assembly. It is the highest decision making body of WHO actually. They meet every year in the month of May at Geneva. So what are the main works? The first one is they establish the international health policy and program. They will also review the work of past year. They provide financial approval for the budget on the following year, and also they select the members to serve for 3 years on executive board. This is the main works of World Health Assembly. The next one is the executive board. The executive board should compose at least 18 members. At present the board has 34 members. Main works are taking action and emergency situations such as earthquakes and floods, and the work on the decision and policies which made by the assembly. So this is the main works they are doing. First of all, World Health Assembly conduct the meeting every year once at May only, but executive board conduct the meeting whenever wherever it's a situation arises. Suppose earthquakes or floods or some problem is arising, executive board will conduct the meeting and they will take the decision. They will also work on the decision and policies made by the World Health Assembly. The last one is Secretariat. The Secretariat is headed by the Director General, and he assisted by 5 Assistant Director General. Basically, the Secretary is having more than 8,000 international public servants. They work actively in implementation policies which is made by the higher officials. It is having 14 different divisions. For example, like epidemiological surveillance, communicable disease, vector biology and control, environmental health, public information and education for health, mental health, etc. This slide shows about the WHO regional organization. Actually, WHO established 6 regional offices to do their function effectively. It conducts meeting every year once. They also talks about budget members of the next assembly. These are the 6 regions. Number 1 is the Southeast Asia. New Delhi is the headquarter. Second one is the Africa. Harare is the headquarter. And for America, Washington DC is the headquarter. In Europe, Copenhagen is the headquarter. Eastern Mediterranean, Alexandria is the headquarter. The last one, Western Pacific, Manila is the headquarter for 6th regional organization. This is about functions of WHO. The first one is the prevention and control of specific diseases. They have set of specific diseases. They works on prevention and control of those diseases. The second one is the comprehensive health services. They, WHO do all related services which can improve the health of the world people. Then third one is the family health. Under the family health, they broadly focus on variety of areas like maternal and child health, nutrition, reproduction, and health education, etc. And environmental health, they focusing in the improvement of housing and also sanitation, recreation facility, working conditions, and other aspects environmental hygiene. Then next one is the health statistics. WHO is actively participating in finding the data which is related to morbidity and mortality. According to this data, they are working in improvement of the health of the people all over the world. Next one is the biomedical research. In the biomedical research, they encourage and also they coordinate with both biomedical research work worldwide with so many countries. Then about health literature, WHO is maintaining the one library which is known as the MEDLAS. It means Medical Literature Analysis and Retrieval System. It is computerized library. It is having data about health all over the world. The WHO also having cooperation with the other organization like other organization like UNICEF and World Bank to works on the health of the people. This is the second agencies which is we are going to talk here, that is United Nations International Children's Emergency Fund. Short term we says UNICEF. It is the agencies completely focusing on the children's health and the children's welfare. So here basically it is started by General Assembly of UN in the year 1946 on 11th December. It was having aim, that is one and only helping the children in war ravaged countries. But after the World War 1953, it was renamed as UN Children's Fund, I mean UNICEF, but still it holds the initial name, that is UNICEF. Also UNICEF is the one of the global organization specifically dedicated to children. So UNICEF's headquarters is situated in the New York. This is about aim and objective of UNICEF. So main aim is to provide long-term compassionate and development assistance to the children. This is the main aim, to providing development assistance to the children. Main objective is to develop community level services to promote health of the mothers and children in developing countries. So they focuses on working the developing country on the health of the mothers and children. Next about structure. UNICEF is guided by nearly 36 national executive board members. It is headed by executive director. Income of the UNICEF is contributed by different government and private donors. With the help of this fund only, they are working in the children's health. This slide shows the functions of UNICEF. The first one is the child nutrition. Always child nutrition is the high priority of the UNICEF. It recommends and provides enriched food like iodide salt in endemic areas to fight against goiter. It also maintains a good association with Food and Agriculture Organization for applied nutrition program. And next one is the child health. For child health, they have provided aid for the production of vaccine and sera. In India, UNICEF supported BCG vaccination and penicillin, DPT plant, triple vaccine plant, and the iodide salt plant. Next about child protection. UNICEF is involving in child protection also from various violence, exploitation and abuse by policy making and implementation. Next about family health and welfare. So it runs various parental education program, daycare centers, child welfare and youth agencies and women's club. Next education, UNICEF also provides fund to purchase science laboratory equipments, library books, workshop tools and audiovisual aids, especially to improve the educational system of the children. It is also encouraging the non-formal education in Anganwadis by supplying educational materials. Actually, UNICEF funded much amount to the Anganwadis in India. Next, they are also running Go-Bee campaign. It has four strategies. Number one is the G. It means growth chart maintenance to find the growth faltering at early stage and take appropriate actions. This is especially occurring, in Anganwadis. They assess the growth of the children with the help of the growth chart. They will find out the faltering. According to the need, they will provide the treatment or follow-up care. Then O is the oral rehydration solution for prevention of dehydration in children. Once the child gets diarrhea, immediately they assess and they provide oral rehydration solution. Next, they are also promoting breastfeeding. They explain the method pattern and also gives good educational method to the mothers how to give the breastfeeding. So through this they are promoting infant health. Next one is the immunization. Immunization of children against diphtheria, pertussis, tetanus, measles, polio and hepatitis and also TB. This is very important works they does in Anganwadis. The last one is the UNICEF InsoCenti Research Center. So this is nothing but they are running research center. It was established in 1988 in Florence, Italy. It is also known as International Child Development Center. Next agency is the World Bank. So World Bank is started in 1944, headquartered present in Washington DC. So the main aim of World Bank is to provide temporary loans to low income countries who cannot obtain loans from other sources for the development. So basically they give loans, financial assistance to the various countries, especially low income countries, to improve the health and the development. This is about objectives of the World Bank. The number one is to eradicate severe poverty and hunger. World Bank want to accomplish the primary education worldwide. They also want to promote gender equality by advancing women's economic empowerment. They want to reduce child mortality and morbidity rate, also improve maternal health. World Bank is working to fight against and destroy HIV/AIDS, malaria and other diseases. Next, about structure. The president of the bank is the higher official of the entire World Bank and he is the responsible for holding the meetings with the board of directors and the overall management of the bank. The vice presidents of the bank are its chief manager for all regions, sectors, networks and functions. Next we will see about Food and Agriculture Organization. Short term we can say FAO. It is a specific agency of the United Nations. It guides and puts international efforts to beat hunger of every part of the world. It also started in 1945. Headquarters is situated in Rome, Italy. And next about aims of FAO: to achieve food security to all and make sure that people will get regular and enough food to lead their active and healthy life of all the people, those who are living in the world. And next about membership, FAO has 197 members at present. It also includes 194 members nations and one member organization and 2 associate members. Next we will see about structure. This agency is headed by Director General with a conference of members nations which used to meet every 2 years once. Next we will talk about works of FAO. FAO effectively contributes eradication of hunger by developing policies to support food security. It helps the nation to improve the living standards of the people. It works to reduce rural poverty by helping the rural poor people to gain needed resources and services for employment and social protection. It also help to build a safe and efficient food system which support smallholder agriculture. Next agency is the United Nations Development Program. Short term we can say UNDP. It was established in 1966. Basic aim of UNDP is to help poorer nations for the development of human and natural resources. Member countries used to meet annually and works for the objective. So what are the works of UNDP? Number one is the industry and agriculture development, and also they works in improvement in education, science, technology of all the nations. The third one is the upgradation of health and social welfare. This is about United States Agency for International Development. We can say USAID. This agency also working in children's development and all people, those who are living in the world. So this agency is developed at the year of 1961. It is involving in various activities of India also. So the mainly works are medical and nursing education, malaria eradication and other communicable disease control, water supply and sanitation. They are also giving various health education to all the people. They also involving nutritional improvement and family planning services. At last, thank you so much for listening me today. I really appreciate that you took the time to see my video. If you have any queries, tell me in comment section. Thank you so much. Bye.